What is a BTK inhibitor and how is this drug class used to treat chronic lymphocytic leukemia?
So BTK inhibitor stands for Bruton's tyrosine kinase inhibitor. These are small molecule inhibitors of Bruton's tyrosine kinase. Bruton's tyrosine kinase is a step that's downstream from the B cell receptor. It's a step in the B cell receptor pathway, and this can be blocked by drugs called BTK inhibitors. BTK inhibitors can be divided into two types. We have covalent BTK inhibitors and we have non-covalent BTK inhibitors. The first covalent BTK inhibitor that was approved was ibrutinib. Subsequent to that, we had acalabrutinib and zanubrutinib approved for CLL. These work very well. They have shown survival advantage for patients with CLL, and they are very well tolerated. The reason that we had the second generation or next generation covalent BTK inhibitors, acalabrutinib and zanubrutinib, it's not that ibrutinib wasn't good enough. It worked very well, but it was associated with certain side effects, especially effects on the heart. It caused atrial fibrillation, and there was a high incidence of bleeding. That led to the development of the second generation covalent BTK inhibitors, which were more specific for the target, BTK target. Most kinases have off-target effects. That means they bind to other areas also, which lead to the side effects. So these were developed, the next generation were developed to have more sensitivity for the BTK and had lesser of those off-target effects. And we have had head-to-head studies between ibrutinib and acalabrutinib in the ELEVATE-RR study, which showed that the side effect profile for acalabrutinib was better. And then we had head-to-head between ibrutinib and zanubrutinib in the ALPINE study, which showed the side effect profile of zanubrutinib to be better. Now, the second type of BTK inhibitor is the non-covalent BTK inhibitor, of which we have pirtobrutinib as the FDA-approved agent, which was approved in December of 2023. For now, it's approved for patients who have relapsed on a covalent BTK inhibitor and a BCL2 inhibitor. And pirtobrutinib is very well tolerated, very minimal cardiac effect, low incidence of bleeding, so very well tolerated agent.